Welcome to our RockPod Glides live update session. And hello if you're watching on YouTube, which will be recorded. And hello if you've joined us on Instagram. We look forward to going through this session. It's going to be a practical session. We've got myself here, we've got Rose, my other co-therapist who you may recognise from live streams and physio channel videos as well. And we've got a couple of real patients ready to go. We've got Martin just down here below who has just run up to see us, so he's in need of some treatment. He had a running event recently as well, so he's got some plantar fascia issues, so Rose is going to be tackling that. And we've got our reliable patient Kim, who's going to be on my couch here receiving some of the RockPod Glide treatments as well. So I thought the first thing we would do is open the new RockPod Glides. Now I've got a set that I've been using, but we've got two new sets here. So we thought we'd do one of these like unboxing videos to see what we've got inside. Okay, so take that, remove the outer casing, open up and see what we've got. Brilliant. So I'm going to come close to the camera so you can see what we've got in there. Yep, there we go. So we've got 6 pods, and immediately you can see they have a different design. The red and the whiter ones are translucent, so you can see inside them, but they're shallower and they have a thicker rim, which is really important. We're going to see why that's important in just a second as we start to use them and glide them across the skin. And also the smaller ones are the smallest rock pods that you would have seen so far. And then the huge black pods are the largest ones, or the largest kind of diameter, if you will, that exist. So they're the smallest and the largest pods, plus they're designed to glide, which is something we haven't seen yet from the rock pods. And this is just dropped out. In every set you get a tub of rock rub included. And not only is that a helpful addition, but it's also rather vital because you definitely need some wax, oil, or emollient to get the pods to glide. They won't glide without that, they'll just stick on the skin. So we're using some of the rock rub, or quite a lot of the rock rub today as we get started. There's a little instruction manual there. You'll find a little bit of information on here, but hopefully you'll get so much more from this video that we're just about to do. So, okay. Did you enjoy that, Rose?
Enjoyed it.
Always fun opening something new, isn't it? First thing I want to talk about, guys, is contraindications. Obviously, a kind of boring but important part of any course and worth just recapping. So the contraindications we would have covered on our RockPods course. And it's really contraindications that are much the same for all manual therapies, particularly massage. You don't want to be using cups or pods over areas where there's poor skin integrity, so broken skin, areas where there's skin irritation or rashes, for example, anything that questions the skin integrity. And there's a host of other contraindications as well, such as bleeding disorders, people who are on anticoagulant medication, other severe health issues, for example. Really much the same as you'd consider contraindications for massage and other soft tissue treatments. And that list that I just discussed, of course, is not exhaustive. There's plenty of other things. But there's a couple of things that we need to perhaps pay a bit more attention to with the RockPod's glides. And I'll talk about those as we get started. So to start off with, you need plenty of emollient on the skin. Now, I usually do use rock rub, but I'm going to use a bit of extra oil because I'm demonstrating I want to do lots more than I would normally do in clinic. So to reduce the friction over the skin, I'm going to use some oil in addition to some of the rock rub. And it's up to you what you use, but you'll know that it's working if you get a good glide across the skin. So we were talking about contraindications, weren't we? Firstly, because you're gliding along the skin, I would suggest that skin integrity is something that you perhaps need to pay a little bit more attention to. So check the skin is healthy. You need to be careful if this skin is older. What am I talking about? Like octogenarians, nonagenarians. You know, the skin on older patients that's lost some of its natural elasticity and glide. The other thing, and this hopefully would seem rather logical, is because you're gliding along the skin, let's have a look at doing that a second. Okay, because you're gliding along the skin, you need to make sure that there's nothing that's going to block that glide, like a mole or a skin tag, for example. Now, it's most likely that the pod would glide over any sort of reasonably sized mole or skin tag, but you wouldn't really want to be crashing the pod or a cup into any significant projections out of the skin. So make sure there's nothing that's going to disrupt the glide as you go over the skin. How are you getting on there, Rose?
Good.
Brilliant. Okay. Now, let's have a look at how to use them. When we do glide cupping or massage cupping, we firstly need to make sure that it is going to glide, so we've got plenty of, in this case, wax and oil on the skin. Then we need to create the vacuum. Top tip for you, don't create too much vacuum. If the vacuum is too intensive, the skin in the cup or pod will be pulled up, creating a dome in the skin. When you try and glide it, the skin outside the pod needs to come into the pod, go all the way up over this dome because of the intense vacuum that you may have created, and then back down the other side. So there's a lot of skin strain and skin pull, which, well, may be uncomfortable for the patient, but it's also going to make it harder for you to glide the pod because the skin is being pulled and shoved and stretched as you're simply trying to glide over the skin. So when you try these first off, guys, just try a minimal amount of vacuum. And to be honest, that's probably best. That's probably what you're going to stick with. But that will make it easier for you too. It will glide so much easier with a little bit of vacuum. As you can see here, that's gliding quite nicely. But if I was to put that on with loads of vacuum, I can see the skin being pulled up in the pod in this case. That is a bit harder to glide, and it may be a bit more uncomfortable for the patient, but there is an element of patient preference here. Some may prefer more of an intensive pull on the soft tissues. Others may like a lighter approach. It really depends on that important therapeutic alliance that you have with the patient. Okay, so plenty of emollient and oil, a light amount of vacuum, so just slightly press the top of the pod down. They will transfer over the contours of the body in places where rigid cups won't. So from my experience, trying to pass a plastic rigid cup over the center of the spine, like this, usually causes it to come away from the skin. But the silicone cup is able to mold over the erector spinae and the spinous processes there, allowing me to treat transversely without any loss of vacuum. Okay. Brilliant. So you may have seen in one of the Instagram videos, one of our favorite techniques is this figure of 8 over the back, which I'm doing just here. Allows you to cover over that lumbar region, moving over the center of the spine, not restricted to moving over the direction of the muscle fibers, and moving over like so. Now, naturally, with this type of therapy, you will get some reddening or erythema on the skin, and that's just something to keep an eye on, because the more you do, the more red it's going to go, and at some point you're going to decide that that's enough. You don't want to cause any unnecessary skin irritation, so you would stop, and that would be sufficient. To reduce that, more wax or oil, less vacuum. That'll allow you to do a bit more work before you continue. Okay, so I'll move on for the purposes of the viewers there. I'll move on to this area here because that should be pretty simple for you to see on the camera, and we'll see if we can get our cameraman to come in a little bit closer. Bear with him, he's got 3 cameras to work with there. I'll ask Rose as well, is that even with oil and wax on your hands, the design of the pods is such that you can hold them quite easily and you don't need to worry about constantly cleaning your hands. And well, of course, if you do drop one of these pods, as we say on our courses, it doesn't matter if you drop them because they're just made of silicone, so they will bounce and there's no issue there. Because if you're working with glass ones, glass cups plus oil, plus movement can be rather tricky. And in this case, yeah, super simple. And that's one of the things I like about the RockPods overall. I'll just come down so I can see you guys. Can you lift the cameras a little bit, Rich? Thank you. That's one thing I like about the RockPods overall, is the simplicity of use. They're if you haven't used pods or haven't done cupping before, it's very easy to get started with the RockPods, very easy to have a positive effect and to work well with the patient. And then from there you can do some much more advanced and patient-involved techniques, which can be very helpful for rehabilitation. And if you're working with a patient, you can have your RockPods nearby, you can grab one of them, do a bit, and then do something else or move on to some rehabilitation or combine it. So you don't have to have a patient in for a specific cupping session, and it's not complex if you want to do a little bit of cupping or try a bit of cupping with the RockPods. It's just a very, very simple thing to do and a straightforward intervention. So one of the aims of the RockPod ethos is to make cupping something which you can very easily use and very easily integrate with your treatment approach. In addition, we're trying to modernize cupping and make it fit in with a Western approach to working with musculoskeletal pain and more persistent pathologies. Okay, so hopefully the patient is enjoying this. Patient?
Yeah, no, it feels good.
Patient says it feels good. It's always a bonus. But I must say, guys, it is actually really nice to do as well. What do you think, Rose?
Yeah, I like
Yeah,
it. It's
yeah.
nicer than the anaesthetic.
Sometimes when we deliver our treatments, it can be as enjoyable for us as it is for the patient, and sometimes more enjoyable for us and less so for the patient, depends what treatments you're giving them. But it's not only is it easy to use, but it just feels, therapeutic for you as you're actually delivering the treatment as well. It's a nice, easy thing, and you feel like you're able to have a good positive effect on that soft tissue movement there. And we've got a combination here of the soft tissue being moved around over the scapula, as well as the pods sliding and gliding over that region. I could keep doing this for the rest of the session, actually. This just feels quite therapeutic for me, and patient isn't complaining, so we'll carry on. But let's change things up a bit. Let's get a bit more movement involved now. What we found from working with the RockPod glides is they are really great just for using passively with patients, and the patients really enjoy that experience, and it feels very involved and a credible therapeutic input, enjoyable for the patient, and patients are generally very satisfied and happy to just lie there and receive the massage treatment, to receive the glide cupping with the RockPods. So often that's enough during a session, and that's really well received by patients. But what we teach in our courses, and what we'll be adding in with the glides as well, is we want to get patients moving or to restore their movement. So it makes sense to get the gliding combined with movement. I'm going to use one of these larger ones here. These are fantastic. You may have seen on the Physio channel Instagram, I was using these on the back. So we'll go ahead and try one here. Let's see if we can put this over the center of the spine. We can. And then see if that glides first of all. It does. Look at that. Super easy. Okay. Now what we'll ask our patient to do is to start upright and then to slowly drop their head, drop their shoulders and flex forwards. That's it. As we glide down over the lumbar spine. Okay. This is one of my favorites. There's a lot more we can do in combining the glides with the movement. And then I'm going to get you to flex forwards slightly over to your right this time. This is also easy for you to see on the camera, simply with the patient sitting and flexing forward, or side flexing in this case, and we can glide like so, okay? So I'll start at the top there, patient flexes over to the right, so stretching the QL on this side, and then gliding down like so, okay? And back up, brilliant. So we can combine the glides with movement, and that's one of the key things that we do throughout all of our education, is combining that manual therapy input with the glides as well. All right, so we've got passive treatments, we've got active treatments. Let's have a look now and see what Rose is doing. Okay, so we're going to see Rose do a bit here, and as you saw, she's spreading the oil out with her hands. It's brilliant just to combine doing what you already do, so just using your standard manual therapy massage, which of course is always well received by patients, and then mixing in a bit of the RockPod and the RockPod glides as well. I haven't mentioned yet, and hopefully you'll get a chance to experience this very soon as you get your hands on some of the RockPod glides, it's a very unique feeling. Now, I'm sure most of you watching have used the RockPods, and that in itself is a unique feeling, but the difference between a pod which is stuck in place whilst you move it around or move the patient, the difference between that and the feeling of a glide or massage cupping using the pods is really quite different, and quite a profound difference. It's like a totally different feeling again. So you've got like normal massage, we know how that feels. You've got cupping, if you haven't had that before, when you first have it, it feels unique, different, maybe a bit weird, hopefully therapeutic. But glide cupping is another thing again. It's another unique feeling. And well, of course, the patients can tell you that and explain that, but I would recommend as soon as you can to try it yourselves, because getting a feel for it, it is hopefully enjoyable, and also you'll recognise that it can be a very unique feeling, and of course hopefully one which is highly therapeutic for the patient. Okay, so Martin, we won't lie, this is not Martin's first go with the glides. He had a secret treatment session recently before the glides were officially launched. But yeah, what do you?
Yeah, very good.
Yeah,
it is good. The muscles relax afterwards quite nicely.
Brilliant. When we asked Martin to join us today, he didn't hesitate. In fact, I think he replied before I'd even sent the message. So I think that's a good sign. And I must admit, I've been suffering from jealousy recently, because when I'm teaching courses, one of the best bits about courses, if you're a participant, is that you often spend half the time being a patient, and you can end up having a few hours of free treatment. And if you're doing a manipulation course or an acupuncture course, then yeah, I mean that might be enjoyable. But if you're doing a cupping, particularly glide cupping and the RockPods course, then if you're a patient of the RockPods treatment for a couple of hours during the day, we have some very happy participants, and people leave very... You'll notice here that the pods are gliding over the hairs. That really shouldn't be a problem in most cases. There's one other thing I wanted to mention. Well, might be other things if I remember them, but I just recalled. The rim of the cup is, of course, designed to glide. It's made of soft silicone, so you're not going to run into any problems. But whenever you're using a cup, whether it's a RockPod, a plastic one, or a glass one, check the rim of the cup to make sure that there are no jagged edges or any kind of rough bits. Even on the new pods, just check that. If there's a little bit of like stray silicone sticking off, or a little rough bit or anything, just make sure that you cut that off or rub that down first of all. If you're using plastic cups, check around the edge to make sure there's no rough edges. I mean, if a cup has dropped on the floor, it might be a rough edge. So that edge is the contact point with the skin. So just make sure that there's no rough bits as you're using the cups. Otherwise you might be unnecessarily scratching across the patient. As I say, not typically an issue with these, but if you are using the other types of cups, plastic ones in particular, then just make sure there's no rough bits around the edge. Sorry, Rose, carry on. Rose can then assist Martin by just flexing his knee as she moves up over the quads, and that could be an assisted movement, guided movement, active movement. But the idea here is that once you get used to using the pods in a simple passive sense, there is an option, and it is a good therapeutic progression to try and bring in some movement in combination. So we'd have here some internal and external glide and an element of shearing or an increased shearing as you're moving the knee, moving the soft tissue over the quads, and in addition externally moving the cup, typically in the opposite direction. So you've got this shearing force in combination. Okay, well, we're getting towards the end of the session now. I'll just recap over what we've gone through. So we talked about contraindications, and we talked about how skin integrity is like extra important with glide cupping, and how you need to make sure that there are no moles or skin tags or protuberances sticking out that may affect the glide of the pods. We also talked about the importance of putting plenty of wax, oil or cream to allow the pods to glide, and you really should be, quite liberal with the covering of those things. The better the glide, the more oil and wax, the better the glide, and there's no reason why you wouldn't want them to glide as easily as possible. And then we looked at the vacuum, and we talked about how a low level of vacuum is best. You can increase the vacuum if you want to, or if the patient prefers a more intense pull on the soft tissues, but a low level of vacuum is best because it's going to allow you to glide easier. There's less skin pull as the pod transfers across the skin. We did some active and passive work. Often patients like the passive treatment, but we can easily get the patients moving whilst we're delivering the treatment. And we haven't mentioned it explicitly, but we've seen that you can do the movements fast and slow. There's typically a glide speed which works best. And if you go too fast, it can be a bit irritating to the skin and possibly to the patient, of course. And if you go slowly, well, that's no bad thing. That can be quite therapeutic. But of course, the speed in which you glide is a variable which may make a difference to the effect on the patient. Thank you to everyone who's exiting and saying thank you. We'll see you soon. It's been a pleasure. Thanks for joining us. Thank you, guys. Thanks for joining us. See you soon.